In a few moments, we expect the Director General of the World Health Organization, Dr. Tedros Ghebreyesus, to speak at the MRNA Vaccine Technology Transfer Hub in Cape Town. It's an important moment for the hub, which has been playing an important role during the pandemic. But it's emerged this week that it appears a foundation which works for the company Moderna, which has produced a COVID vaccine, has actually tried to have the Technology Transfer Hub shut down. The person who broke the story is the investigations editor at the British Medical Journal. Her name is Madlen Davies. Madlen, good afternoon to you. It's an incredible story. What's the accusation against Moderna and this organization that's linked to it called KENAP?
Sure. So the accusation is against the KENAP Foundation, which is a consultancy based in Malta, and it actually represents the vaccine maker BioNTech, just a point of clarification, not Moderna. So this all started, the World Health Organization hub was set up, and it asked Pfizer and BioNTech and Moderna if they would license their technology so that companies across Africa could start making COVID vaccines. But both companies refused. So the hub, in partnership with African companies, Afrigen and BioVac, said instead it would create a vaccine from scratch. So it then began, the hub, reverse engineering Moderna's COVID vaccine in order to learn how to use the technology and teach other companies how to make mRNA vaccines. But the KENAP Foundation, which, as I said, represents BioNTech, sent letters to members of the South African government and to European officials, and it said that this World Health Organization project was going to infringe patents, it wouldn't be successful, and that it should be terminated immediately. And it made these claims in those letters and in meetings with government officials, including those that might fund the hub. So in November, the Medicine Patents Pool, which is a global organization that negotiates license for medicines and vaccines and is co-running the hub, put out a press release which said unfounded rumors are being spread that the hub is going to infringe patents. And Charles Gore at the Medicine Patents Pool told me those rumors were ridiculous and weren't true. And we now know it was KENAP Foundation, BioNTech's representative, spreading those rumors.
So someone who makes COVID-19 vaccines was trying to stop basically people in Africa from making COVID-19 vaccines. Have I understood that correctly?
Yes, that's correct. So the allegation was that the hub would infringe on patents. But as the Medicine Patents Pool explained in its press release, South African law allows for research and development. So what the World Health Organization hub was doing in reverse engineering Moderna's vaccine was completely legal. And the Medicines Patent Pool has a lot of experience in patents and negotiating licenses. So it's not an organization that would go about infringing patents.
And we're absolutely certain of the relationship between KENAP and BioNTech. I mean, and I suppose the question, I mean, you're a journalist, I'm a journalist, we always ask the same question, who benefits? BioNTech would benefit if this mRNA vaccine transfer technology hub was closed down.
Indeed. So we asked, KENAP Foundation confirmed that it's been represented, but that it's representing BioNTech. We put all these allegations to both KENAP Foundation and BioNTech. Unfortunately, they didn't address the allegations directly, but sent statements saying that they were committed to increasing vaccine production on the continent. So the other interesting thing is that the documents gave more details about BioNTech's initiative. So BioNTech has a separate initiative to the World Health Organization's hub. If you remember, it refused to transfer its technology to the hub. It announced a few months ago that it wants to build factories that can make mRNA on the African continent, and that announcement was welcomed. KENAP's documents give a bit more detail on that. So they describe how BioNTech wants to create an exact replica of its mRNA production line in Marburg, Germany. So every single detail of the factory will be exactly the same, and it wants to transport those factories in a series of sea containers and place them in African countries. So at the moment it has agreements with Rwanda and Senegal. And at the time it sent these documents, it was proposing a similar setup in South Africa. And these modularized factories can be a very good idea, but the vaccines still need to be approved and regulated. And the KENAP Foundation documents showed that it was proposing a new regulatory pathway in which the European Medicines Agency could license the factories because they were made in Europe, and then they would be sent to Africa. And it said that local regulatory capacity could be built up in the longer term. And so I spoke to regulation experts who said that this new regulatory pathway was paternalistic. So Dr. Margaret Sigonda Namondo, who's leading on regulation for the African Medicines Agency, said she had lots of meetings with Kennett Foundation and they weren't very well informed, and that she told them they should work with the regulatory systems that already exist on the continent rather than trying to forge a new one.
Well, I mean, so many of the regulatory frameworks sort of copy and paste from each other anyway, in a way, and I mean in a very comprehensive way. So it's interesting that BioNTech would be doing this. I hate to be this cynical, Madlen, but could other pharmaceutical companies that also own COVID-19 vaccines have tried to do the same thing? I mean, if it would benefit one pharmaceutical company, it might benefit others.
Yes, so I haven't uncovered any evidence of other pharmaceutical companies doing the same, so I can't speak to that. What we do know, fortunately, is that Kennett Foundation's actions don't appear to have had much impact. So the World Health Organization hub is still going ahead. In January, it successfully recreated Moderna's vaccines. But I guess what we don't know is which countries might have been dissuaded from joining the hub, or which funders might have decided not to fund the hub as a result of this lobbying. So now everyone is watching BioNTech with a very close eye. It's promised to begin building these mRNA factories in Rwanda and Senegal in the middle of this year. So we hope that this is the case and that we'll begin to see vaccine manufacturing that's so badly needed on the continent soon.
Madlen Davies, thank you very much indeed. Investigations editor at the British Medical Journal. I really do appreciate the time.